It takes a lot for doctors and nurses to be scared. And if they're telling you they're scared, you should listen.
As COVID-19 cases continue to fill up Alberta's ICUs, one psychiatry resident was shocked to get an email asking if his colleagues would consider volunteering for redeployment.
I have those skills. I have that background. I have not had to practice those skills in over 5 years. So, I didn't put my name forward. I don't feel comfortable. I don't feel pressure to put my name forward. But the fact that we're asking for that is scary.
Alberta Health Services says staffing is the biggest challenge of this fourth wave, as the front line is already exhausted.
Ideally in the ICU, you want one-to-one care because those are your sickest patients. And now we're looking at models where you have you get 3 patients to 1 nurse, and that might not even be an ICU nurse anymore.
The Edmonton Zone Medical Staff Association calling for immediate action, just hoping cases go down so they don't reach triage protocol, where decisions based on potential for survival are factored into who gets a bed. AHS tells City News Alberta has not yet used triage protocol, but it will if all other resources are depleted. They are asking staff to brush up on the protocol.
We need more than anything else is effective action that takes the pressure off the acute care system and slows the transmission in the communities.
Former Chief Medical Officer reminding it's not just COVID patients impacted, but everyone else who needs care.
70% of Albertans have voted by getting 2 shots in their arm, and they're at risk of losing a healthcare system they need because 20% of the population hasn't done it yet.
These people, these healthcare workers, pulled from different clinics and services. Once again, I think we're starting to throw out this concept that there's a reduction in services now, and we're not happy about it.
You hear all my colleagues are busy. I would argue that all physicians, all nurses are busy.
For this psychiatry resident.
And so for people who think that you can just solve this with a stroke of a pen by recruiting more doctors, more nurses, you're ignoring, number one, the special skill set that's required, and number two, all the downstream issues that are going to be created by that.
Reminding it's a complex issue, and they're asking for help by getting vaccinated and taking steps to reduce the spread of COVID in the community. In Edmonton, Carly Robinson, City News.